Welcome to Local Doctors on Call. I'm Grant Boxleitner. Our topic is New Year's resolutions, and I'm joined by Dr. Stephen Roensch and Kevin Pierce. Gentlemen, welcome to the show.
Thanks for having us.
I'd like to start by having you tell the folks a little bit about your background and where you work.
Well, I am the Dean of Clinical Sciences at East West College of Natural Medicine, and we are a college, and we educate acupuncture physicians and Oriental medical practitioners, as well as our massage program.
And Kevin Pierce, you're here. A little bit of your background.
Yes, I am the academic dean at the East West College of Natural Medicine, and I oversee the Oriental medicine program on the academics administrative side, as well as we have a new massage therapy program we're also running there. My background is actually in massage therapy and rehab therapy and also education management. So.
All right, gentlemen. Well, New Year's resolution, it's always a popular topic this time of year. We are in the new year now. How can we use Oriental medicine and acupuncture to assist with these New Year's resolutions? Maybe keep us on track.
Okay, that's a great question, Grant. First of all, most every New Year's, for whatever the reason, we all want to turn over a new leaf. So we make resolutions, sometimes we keep them and sometimes we don't. Usually involves something I'm going to begin anew or something I'm going to give up. So depending on what the resolution is, certainly that the person has made, would depend on how we can help them. But let's pick the number one thing that most everybody says. And they go, well, I'm going to start eating right, or I'm going to lose weight.
Lose weight.
Okay. Probably 1 out of 3 Americans every New Year's makes that same resolution. and sometimes they keep making it most of the time because it isn't working. So the first thing we would do is try to identify the problem. In other words, why is it that they're not losing weight?
Right.
And there's a number of reasons for that.
Yeah, what are some of these possible reasons?
Well, the first thing is obviously the diet. Are you not losing weight because of what you're eating? Are you not losing weight because of when you're eating? Another question, where do you eat?
And even maybe perhaps how much you eat.
Exactly. And you know, we think about, is this also, could it be a glandular problem? Is it a metabolic problem?
Right.
We have 100 trillion cells in a human body. 60% of those live in our gut, where 80% of our immunity lies. So sometimes if the gut flora, the intestinal flora, is out of balance, then our ability to absorb and assimilate nutrients literally results in us being malnourished, despite the fact that we think we're eating a pretty sound diet.
Getting enough food.
Exactly.
Interesting. And so Oriental medicine, and you can potentially start to look at that through your practices.
We can, and the one word that comes to mind, and we'll talk about it more later in the show, but there's a word that we have that it doesn't really exist in Western medicine, and that word is to tonify. Tonification literally means boosting or strengthening. And if we look at the way acupuncture and Oriental medicine works, and it's very, very involved, but we'll keep it very simple for today's program. But we have the ability to, if we liken the body to, say, a computer, and we are the computer, and the keyboard would be composed of what would be the acupuncture system or the acupoint system on a human body. In other words, to simplify, we push certain buttons to make certain things pop up to run this program. And so thousands of years ago, the Chinese, through trial and error, figured out that the body is mapped with a little, if you will, superhighway system. And we call these meridians or channels.
Okay.
And along these channels are little points. We could call them buttons or triggers for today's show. And when we pull a certain trigger, we get a certain response over here. And again, 5,000 years of trial and error, we have the ability to tonify certain systems, certain things. If we want to communicate with an organ, we know, again, if we push this button and this button, we'll get a positive result here. And if we have a problem, whether it be too much weight, unwanted weight, poor health, a lot of times a system or more systems are simply like a scale, they're out of balance.
They need to be brought back into balance.
Exactly.
Okay. Now, as far as weight loss, can this approach help with weight loss?
It can, and there are a number of factors, again, that come into play here. Number one is, as I said, when I said, where are you eating, sometimes people look at me funny.
Yeah.
And you mean like in the living room on the TV tray, or do I eat in front of the TV set or at the dining room table? I go, no, where do you eat? 80% of the teens, preteens and teens in this country eat 60% of their meals at least once a week in the car.
In the car.
Okay, and so you can figure out where we're eating
Where
now.
they're eating.
So
somewhere.
it is what we're putting into our mouths, what time of day we're eating, how we're eating, proportions as you suggested, and so on.
Yeah.
So one of the things that acupuncture and Oriental medicine can do is balance these systems. And we can, by tonifying, we can improve our rate of absorption and things within our digestive system.
Helping you become more efficient as you digest food and potentially
Exactly.
maybe not carry as much weight?
It's possible. Again, though, to be fair, there are three aspects to weight loss. Number one, lifestyle. Number two, diet.
Right.
And number three, exercise.
And even in your practices, you tell the patient these are the three things you have to always keep in mind.
We do, but we actually add one because we have to, because of what we do. So most everybody knows, they go, yeah, I know, get plenty of rest, exercise, and here again is the phrase, eat right.
Eat right.
And we say those are all the tools necessary to be what we would call healthy. What we call, actually, the word is apparently healthy.
Okay.
And we were just talking a moment ago about people that say, I'm healthy as a horse. My friend of mine just said, I went to the doctor, I'm healthy as a horse.
Healthy as a horse.
But this person lives off fast food, lives off of soda pop and things like this. So in his mind, feels pretty good.
Right.
But is he really healthy? So he would be what we would call, as we all hope to be, apparently healthy. But the factors that determine this are certainly sufficient rest,
right,
so that the body can rejuvenate. The second thing is a proper diet. The third thing is exercise, because we are human beings or machines. We're designed to move. We're not designed to be sedentary. And the fourth thing is, and we can talk about this in terms of massage too, what are you doing from a preventative medicine standpoint?
Yes.
What are you doing to prevent illness or disease or obesity? And most people say, well, I'm doing it. I eat right, I exercise, and I rest. Because there's got to be a fourth element. And that is preventative medicine. And this is where TCM and Oriental medicine, traditional Chinese,
you come in.
can come into play, because it does have, as we said earlier, the ability to tonify, strengthen certain mechanisms in the body, strengthen processes in the body, and to boost.
And once you do that to a patient, just take any patient that you've had in recent weeks, what is the response to this? Is it usually positive?
Generally it is, but again, if we're talking, and we are, for our first resolution today was the guy that wants to lose weight.
Yes.
We tell him this: we're going to do everything in our power. We're going to give you 100% effort, 100% of the time. I need the same thing from you. And I tell my patients, there's two people in this canoe, and we both got an oar in the water. I'm going to row on my side, but you got to row on yours. So that is, you have to follow the proper dietary regimen.
And you give them this as they visit you.
Absolutely. We'll talk about nutrition during our consultation.
Sure.
If that's the direction that the treatment plan needs to go. So we'll say, here's what you need to do. So that puts a lot of the onus, as it should, back on the patient.
Right.
And a lot of times we'll see our doctor, we put everything in the doctor's lap and go, here's my problem, you handle it. Tell me when to show up, where to show up, what what I need to do to get. You got to get me healthy.
Right.
And so, in the broad perspective
and that's an awesome
of medicine,
responsibility, but it doesn't seem realistic, because they're only spending an hour or two a week with the doctor at most.
Yeah. And so really, the whole idea of wellness, it falls into, like I said, my oar's in the water, but I would need the patient's oar in the water, and say, are you going to follow this nutritional regimen? We need to up your walking or your exercise, or I don't care what you're doing, CrossFit or Body Beast or P90, but whatever you're doing, if you're going to do that, that's what you need to do on that end of it. But you have to take responsibility for your health. If it was magic and I could put one needle in you and we'd all lose 10 pounds, we'd all be skinny, we'd all be rich. But there is no shortcut.
No.
There isn't.
They have to put the time in outside of the college.
Most people take better care of their car than their body.
Wow.
It's a fact.
And these resolutions, they say they want to do better, and maybe they can, but it really takes some dedication on their part.
Absolutely.
All
But you know,
right.
there's a corny joke that comes to mind, and this is really bad, so I'm going to apologize for it up
All
front.
right.
How many psychiatrists does it take to change a light bulb?
How many?
Okay, only one, but the light bulb has really got to want to change. Now, I apologize, I didn't write that, but I heard it, and I remember thinking how stupid that is. But it's true. If I need to lose 20 pounds, and I go to you, and you're my doctor, and you go, here's what we need to do, and I go, yeah, doc, gosh, you know, that's going to really cut into my TV time, and I don't know if I want to get right back into the gym right yet, and I'm not ready to give up the chips and the Coke. And so I have to want this more than anything. It has to be a priority. So we'll ask people sometimes in a very tactful way, what are your top 3 priorities in life? And a lot of times it's, well, it's my family, it's my job, it's my house or car. But we go, I know she didn't mention your health in there anywhere. So we got to prioritize, right?
Well, Dr. Roensch, we're going to pick up on that in just a moment, and we are going to have more local doctors on call right after this.
Hi, I'm Dr. Stephen Roensch, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental medicine.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome back to Local Doctors on Call. I'm joined by Dr. Stephen Roensch and Kevin Pierce, and they're at the East West College of Natural Medicine. And we've been talking about acupuncture. So how can acupuncture really help with weight loss?
Well, again, as we said earlier, if we could just put one needle in the body in one spot, and that would result in weight loss, right? We'd all be doing great.
Yes,
of course,
we would.
There are no shortcuts. So one of the ways is, and we do a lot of work with nutrition, and the other way would be to balance the body. Remember, we said that illness results when the body is out of balance. So a healthier body, a body that is in balance, will always do better than a body that's out of balance in terms of weight loss and in terms of everything. So the first thing we would do is do acupuncture, just to be sure that all systems are go and everything in the body is back to a state of homeostasis. Then we would do a lot of nutritional counseling, and perhaps, if necessary, set up a dietary or nutritional regimen, and back again to step back to where we said about the intestinal flora. If that's out of balance, then we're not absorbing what we need, we're not assimilating what we need.
So you can use acupuncture to help treat that.
Old expression, and there's a lot more to Oriental medicine than this, but it's an old expression. And it goes back hundreds and hundreds of years, but they say acupuncture walks on 2 legs.
Walks on 2 legs.
It was acupuncture and Oriental medicine, or rather acupuncture and the medicine part of that, the herbology and so on. So in other words, what we do with the system to balance it from an acupuncture standpoint, and number 2, what we put into the body. And in ancient times it was herbs, today it's herbs, it's nutritional supplements, it's homeopathics, it's a whole lot broader spectrum.
Now, how can all of this help with food addiction? A lot of people are dealing with this. They have a certain food and they want to eat and they consume a lot.
That's true. First of all, we would find out what things you're addicted to. And without getting too deep into it, certain imbalances in the body, and not just chemical imbalances, but certain organ systems respond to certain flavors and tastes.
Even
and
hormonal imbalance, perhaps?
That as well. Certainly, we talked about glandular problems and so on. But if we are, again, back to balance, if we're out of balance, we have to reestablish what is a normal balance to the human body. And there are certain protocols that we follow when we talk about food addictions.
Okay.
There's an organization that was started in New York in 1972, and it's called NADA. It's an acronym for National Acupuncture Detoxification Association. It was set up for the purpose of drug addiction clinics in New York City, and they found that through research there are certain points in the ear that we call auriculotherapy that communicate just like acupuncture points on the body. However, this is a more superficial, right, appendage to the body. The circulatory system is very near the surface here.
Right.
And if you think about your ear, and this is going to, for some of our folks at home, this may be a little out there, or not, because people are better educated today about this than ever before. A lot. But your ear is a microcosm, if you will, of your entire body. Every organ, every part of your body, most every function in the body can be addressed through auricular or ear acupuncture. And one of these is certainly food addiction, certainly drug addiction. We'll talk about that, and cigarette smoking and other things. But we use this a great deal to communicate with the body, and it does so rapidly. It's quick, simple, it's easy, it's painless. You don't have to disrobe, put on a gown, and it kind of will boost any treatment we do thereafter. So if you've ever seen a person with little seeds in their ears, little pieces of tape over them, sometimes you'll see a person's
What's that from?
Well, we said that the ear is a microcosm, a miniature of the body. It's like a remote control for your TV set. So there are certain points in the ear. There's one point particularly called a hunger point. There's points that communicate with the glandular system, with every system. And we locate these points. We actually have big ear models. You've seen them in our clinics and everything. And we look at a big ear, and we'll pick out the points we need, and we'll communicate directly with certain organ systems.
And that varies patient to patient.
The points?
Yeah, which ones you're going to identify. Yeah.
Yeah, it would depend. Every point prescription is a little different for everybody, and some may be somewhat similar.
Okay.
But we actually are, we said this is what's unique about the auriculotherapy is that the patient literally takes that treatment home with them. So we put a few needles in your body, and at the end of your treatment, the needles come out, you go home. As an adjunct to this treatment, we may use the ear additionally or by itself, as in a lot of the addictionology treatments, and we'll take a little probe, it's like a little metal rod with a BB on the end of it, and we'll probe points we know to be reactive.
Right on your ear.
Absolutely. And all throughout your ear. And if they're on the exterior, and if they are tender, and these are certain points we know we have to use in this protocol, we take a little tiny square of tape, it's flesh colored, it's about 1/4 of an inch, and on the other side of it is a tiny little seed. Sometimes these are magnets, sometimes they're gold or silver. And they're placed over this point on the ear. And the idea is that the patient will massage the ear. They'll just kind of roll it around until it becomes a little more tender.
They'll use that seed as kind of a massage.
They're pushing buttons on the computer keyboard. And so we'll say throughout the day, number one, if just the presence of the seed is enough to activate the point in the ear. And this is the miraculous part. The body gets the message. The body knows what to do. So this is another way they can take the treatment plan and take it home with them. And
earlier you mentioned drug addiction and alcohol. It sounds like you can make this approach for those two addictions as well?
Yeah, and if we think about, let's talk about, say, drug addiction. Obviously the effects of the drugs are body-wide. Nobody takes drugs for any length of time and doesn't do harm to the body and the cells of the body, again, of which we have 100 trillion. So we have to look at, if we're a smoker, for example, and we'll get to that in a moment. But obviously, the number one thing we think about is, oh, my lungs. It's not just your lungs. It's your entire cardiopulmonary, circulatory system.
Respiratory.
Yeah, organs. You can't smoke, and the effect, the polynuclear aromatic hydrocarbons and the carcinogens don't just stay in one place. They go body-wide. And so a lot of times we'll see a person that goes, well, I smoked for 20 years. They've x-rayed my lungs. They've looked at my lungs are clean. And we say that, we go, wow, good for you. The likelihood of that is slim to none. But if that's the fact, good for you. The likelihood your body is clean because of it is very, 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 very limited. So we would naturally boost the organs that are going to be affected by the drug, by the overeating, by the cigarettes, and so on.
And you can treat that through the ear approach and general acupuncture.
And body-wide. We wouldn't rely just on the ear. Again, this is an adjunctive treatment therapy that we use, certainly.
All right, and you'd mentioned smoking a moment ago. Can you actually help people stop smoking using some of this?
You can, and I like to be upfront with people. It's a lengthy protocol.
Yeah.
You know, for example, it would vary from one clinic to the other, but it's lengthy. So it's kind of a blitz program. It would be like, say, 3 times a week for 3 weeks, 2 times a week for 3 weeks, once a week for a month, and then do follow-ups. It may be more or less than that, but that's kind of an average. A lot of times people will say to me outside the clinic, people I know say, well, you know, I need to quit smoking.
Right.
And I'll say, well, all right. And they go, can you help me? I go, I can help you. The medicine can help you. So we're going to do some herbology. We're going to do some acupuncture. But number one, first and foremost, you know where this is going. Here's what you have to do.
Yes.
You have to not buy cigarettes.
Right.
You have to not smoke cigarettes. You have to not bum cigarettes.
There's a
This is
personal
what you have to do.
responsibility here.
Now, and if a patient says, well, what if I cut back? That's fine. You know, what we can't do as human beings is go, I want you to go home right now, and here's a person, let's say, that's a 2-pack a day guy for 40 years. You're going to go home, and that's it. No more smoking.
Right.
That his body's going into withdrawal. So we have to be reasonable. And
Right.
he says, well, I'm going to cut down to this many. We go, good, baby steps. Just like with eating. If I say cut out all sugars, all carbs, anything white, cut out anything fried, cut out anything that's not a natural food. How about if we do this? 1 less can of Coke today. And people go, well, I can do that. We go, good, then there's our start, right?
Right.
If we got to start somewhere.
Yeah, it's
We're
a
not gonna
whole
take giant
process.
strides are great, but it takes a tremendous amount of intestinal fortitude, willpower. You got to want to do it. So we take baby steps. Let's regress ever so slowly. You know, let's do it in little steps.
Great information, and don't go away because we'll be right back.
Hi, I'm Dr. Stephen Roensch, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental medicine.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome back to Local Doctors on Call. We're talking about New Year's resolutions. And Kevin, I'd like to talk a little bit about massage therapy. How does that, or how can it affect weight loss?
Well, along with what Dr. Roensch was saying, is that most alternative therapies are going to be a part of a larger protocol.
Right.
Most people are going to enter into the new year with, you know, a couple of big things they want to accomplish
Yes.
as part of the resolutions, but a lot of times the steps that they take to reach them aren't always organized, and they're not always part of a bigger protocol or what we call sort of a regimen.
Right.
And so, you know, if you're going to work out, people sometimes think, okay, well, I'm going to go buy a new set of workout clothes, I'm going to join a gym,
Yeah.
and I'm going to buy a new bag. And they don't always think that there's going to need to be other things added to that. You know, you're going to need to develop a recuperation. You're going to need to
Right.
get more sleep probably. You're going to need to eat differently because your body's going to go through a process of change.
And I imagine if you haven't been to the gym in a while, these muscles can potentially get sore and stop
Absolutely.
functioning properly. And, you know, I'm assuming that you could really help someone that way.
Absolutely. Within massage therapy's scope of practice, we focus primarily on the soft tissues and helping the body to function at a better level, returning to that functional state of homeostasis, of balance.
Yeah.
And a lot of times people who work out for the first time, they're going to get cramping, they're going to get sore, lactic acid buildup, which is
Yeah.
a byproduct of muscle, contraction. And so massage therapy, first of all, is a great way to not only aid with existing sort of New Year's resolutions like
Right.
working out.
Keeping
it's a
you
great
on point.
it can help you with that, but it can also help to support those things, like helping you to get better sleep, stress relief. So the question of weight loss is, number one, if someone's going to the gym and they're working out, they're increasing metabolism, they're burning more calories,
right.
They're on the right track to get weight loss. With massage therapy, what that will do is that will support the body to have less pain, get better rest, but also to help have what's known as a greater sense of body awareness. Is that if you know where you're hurting and then you get a massage and you're able to talk with your therapist about the specific areas of need, you actually gain insight, you get educated about your body's function, and it helps you to sort of go that next step because you know more. And, you know, the old saying, knowledge is power. Massage therapists truly do want to get involved with educating their clients and helping the body to function better, especially within that post athletic stage, we call it, you know, the post-activity rehabilitation stage, and getting back onto the treadmill, so to speak, with less pain. So the less pain they have, the more frequently they're going to want to go back to the gym.
Be there,
absolutely.
Stress-free. And now, how does exercise integrate into the OMAP weight loss?
Well, we would think about, probably when we talk about exercise, and we were doing that on the break. If that's my resolution, just to get back to what kind of was our begin point, was if I'm working out and it's my resolution to get back in the gym, like Kevin just said, if you're an athlete or you're an amateur workout once a week person, couple, 3 times a week at the gym, up to and including the serious athlete,
right,
you're no stranger to pain. And the harder you train and the longer you've trained, the more you've probably pulled this, strained that, sprained this, you know, maybe you had an arthroscopic knee surgery or something. But what we can help is in the repair. Number one, remember preventative.
Right.
So if my body's healthy, doesn't mean I can't hurt myself. Doesn't mean I can't get sick. It means that my machine is in better running shape and it's getting regular tune-ups. And so energetically, by adjusting the body through acupuncture treatments, through proper nutrition, we have a better mechanism going into this race.
Right.
Now, in the event that we overtrain, as Kevin said, and we've stressed a muscle, we've got lactic acid accumulation and so on, or what we call overuse syndrome. Certainly, we can address these things easily.
So it's a multifaceted way of addressing
Absolutely. And in fact, if you look kind of on the global level, especially like soccer, because that's all over the world. Soccer teams, a lot of athletic teams in other countries have always had Oriental medicine and acupuncture people on their staff.
That travel with
because
them.
Because they're all over the world. They're used to getting it. And that's happening more and more in this country, and we're happy to see that. But you don't have to be sick to get a massage. You don't have to be, or feel bad or hurt.
Right.
You don't have to be sick to have acupuncture. Right? You have to be in balance. But first of all, like we said, you got to want it.
Yeah. Gentlemen, we're almost out of time, but let people know where they can get more information about this and how they can reach out to you.
Absolutely. The college is always enrolling in the new programs for massage therapy and for the acupuncture and Oriental medicine. The phone number is 941-355-9080, and the website is ewcollege.org.
All right, and anybody can come by, and you guys have tours and things like that?
Absolutely.
We do.
And the clinic is open to the public. If you'd like to come down and get a treatment, we will be offering massage later in the year. Right now, we just started our program, but for acupuncture, Oriental medicine, herbal treatments, and other types of therapies that are under that scope of practice are available.
Gentlemen, thank you so much for being here, and that's going to do it for this edition of Local Doctors on Call. We'll see you next time.